Thank you for joining us today. Today we have as a guest Natalya Mytareva, who is the Executive Director of CCHI, or the Certification Commission for Healthcare Interpreters.
Well,
And Natalya, we have a first question to you. Looking at how the interpreting profession has so far fared under COVID-19, what are the lessons learned from the CCHI perspective?
well, thank you for inviting me. And one of the most important things that we realized as an organization is that we have the role to listen to all the stakeholders in the profession and the industry and to bring them together and to help all of them. What happened during the first weeks of the COVID-19 pandemic was that different stakeholders, interpreters, language managers were reaching out to us with different questions, which technically have nothing to do with certification. But, certification body is not just about the exam and testing. It is about making sure that we represent the current state of the profession, and we also represent the current practice and reflect it in our exams, in our policies. And so we are an authority, but at the same time, we'll learn from the ground up. And what I noticed personally through the conversations during these weeks following the pandemic, beginning of the pandemic, was that organizations, be it hospital language departments or language companies, that put the care team as at the center of their business model, who viewed healthcare interpreter as a member of the care team. Those organizations were able quickly and efficiently to adapt and function to the best of their ability under the circumstances. Yes, they took time. Nobody was ready for the changes in the first week, but they knew where to go. They had, if we take a language department, for example, they had multiple venues for providing interpreting services to their patients and providers. They had the over the phone or video remote interpreters, they had staff interpreters, and they had contractors. With the language companies that understood that the healthcare interpreter actually is a vested part of healthcare, not just of the interpreting or language business. Those companies were also understood that they need to adjust their practices. They need to, be willing to go an extra mile with connecting providers and patients through the interpreter. And however, what I saw, and we other commissioners saw during the first weeks of pandemic, that if an organization thought of healthcare language interpreting as part of their extension of their language services only, meaning it's the same as translation, the same as conference interpreting, they were at a loss. Same thing, agencies that, we have very many local small agencies that view it as a part of the social service they provide just to the community and mainly serve the patients and forgetting the whole healthcare and provider side. They also were not able to adapt because they usually provided the services face-to-face, and overnight it became impossible, and they had the workforce that was able to serve the patients and the providers, but they didn't have the paths to connect and get into the flow. So that's the main lesson that we learn is that as an organization, we should be more active in connecting stakeholders, in sharing the best practices, in letting them know that this is how it's done in this part of the country, and this is how it's done for this level of language company or a language department at a hospital, because this disconnect that was happening across the board in the whole world. I'm not saying that our profession was any different than anybody else, but that disconnect was something that we felt, and I think we did a relatively good job of stepping up. If you remember, we held the webinar March 21st, where the commissioners shared their perspectives. We also created the resources page for remote interpreting and COVID-19 resources. And one of the things that we were not quite comfortable with, to tell you the truth, as an organization, is when people, mostly interpreters, would ask us, oh, is it okay to do everything in remote interpreting? Well, as a certifying entity, we don't dictate the roles, right? We reflect what's happening. So we wanted to make sure that we connect with National Council on Interpreting in Healthcare and talk with other professionals and trainers and language managers across the country, that we all are on the same page and we're all agreeing that in this kind of particular situation, that is something that we all need to do. And I'm happy that I think as a profession, we did good. We should pat ourselves on the shoulder and say that we not only survived, but we actually contributed to the success of healthcare.
And as we watched CCHI step up and take a leadership role for the entire country, if I may say so, on how to cope with the situation. I also wanted to ask you, how did this COVID-19 situation affect CCHI as a testing organization? What changes did you have to make, and are some of them going to be long-term or short-term?
Yes, that's the actual other side of us organization, testing, delivering exams. And what we discovered is everybody else across the world, that test centers closed. And I don't know if all of you are aware, but from March 17th through April 30th, there was no testing done across the United States for any profession, any certification program. And we're among the organizations that felt it, along with graduates of medical professionals who needed to take their medical board exams, nursing qualification exams. All of that came to a halt. So we kind of thought of the multi-angle approach. And the first thing we did is we applied to or appealed, I would say, to our accrediting body, the National Commission for Certifying Agencies, with the request to allow us to provide the written exam, the core CHI exam, online, because currently in the testing world, until COVID-19, online delivery was not considered equal in terms of fairness and validity compared to the on-test site delivery. And we were granted the permission to do that until either we fully reopen our operations, which could happen in the next couple of weeks, or until they conclude the study. One of the things I want to commend NCCA and in general my testing partners, other organizations, is we base a lot of decisions on data. And NCCA is now conducting a study comparing the on-site delivery that was done in the first 3 months of this year with the online delivery. And around the fall, they were hoping to do it earlier, but around the fall, they will announce if these two modalities are comparable and produce the same valid results. And if the answer is yes, then we'll keep that for the rest of our existence. And that's kind of the answer of your second question, is what is to stay long term? I sure hope that that will be the case. However, if the study proves that online delivery of exams of high stake level, because they're different exams, right? There are exams for college, there are exams for high school students during them, and they have different requirements to validity compared to certification exams, because certification exams make the HR decisions, employment decisions. You can get fired or hired if you are certified or not in many professions. So for that reason, it's a little different than any online learning or testing. So that's the first angle we took. And we were happy that we started online delivery on May 1st, and we'll continue as long as we're allowed by the accrediting body. The second one, we realized that we all have financial burden right now for different from different angles coming at us, and we adopted the policy that we reduce our renewal fee to certified interpreters, because those are the frontliners who have been working all these weeks and months of the pandemic, to reduce their renewal fee by 20%. That's the maximum we could do. Even though non-profit, but we still need to sustain ourselves. But we're happy to do it retroactively as of March 1st. So all the renewals due from now until the end of the pandemic. So we hope to review the situation next spring, early next spring, and see if by that time we all have recovered or started to recover. I don't know. Don't have the crystal ball here, but that's when we'll see if we extend it again. But at our end of the pandemic, end of the most difficult impact of it, that will be when we will discontinue that discount. And the third approach is to realize that even when we fully reopen our test sites, for various reasons, some of the candidates will not be able to take the certification exams during this time when it is still risky to go anywhere. And we instituted what we call provisional core CHI certification. It's not anything different. It's just the fact that until now, if you are interpreter of Spanish, Arabic, and Mandarin, you didn't get any certificate if you passed the written exam. You had to wait for your oral exam certificate. Now, recognizing that there could be delays for many reasons, we instituted this provisional core CHI certification or certificate that was actually emailed yesterday to all qualified candidates, and it's valid till May 20th, 2021. And after that, individuals will have to take the oral exam within the 3 testing windows following the opening of following that date. So out of this 3, I hope the first one is to stay. The other 2, never say never, but we will reconsider them next May or next April, because we think it'll be premature to reconsider things in the fall. It'll be just too soon, because the main economic impacts will just really kick in at that time.
And what do you think is the importance that the certification plays for interpreters? Because we hear sometimes that, oh, just maybe a little bit of training on how to interpret or will suffice. Why certification?
Well, of course, you're asking an interested party here, but I'm also an interpreter. I'm also an interpreter trainer. So I do feel that my answer will reflect not just my official CCHI position, but my also personal and professional belief. Certification is the guarantee to a point of quality interpreting or quality performance of that individual. Yes, of course, we cannot guarantee it 100%, but this certification shows that the interpreter understands the role, all the 3 modalities, how to learn new terminology, how to react under stress, and all these things came into play during this pandemic. That's why I think the certified interpreters kind of were the pioneers and at the same time role models during this pandemic, because they were able to demonstrate to their other team members, doctors, nurses, IT professionals, CEOs and vice presidents of their healthcare organizations, that they understand that they need to adjust to the situation, that they understand how to switch from one modality to the other. And because on our exams, we have the questions that relate to all 3 modalities. And so for certified interpreters, that transition was a little maybe easier than to interpreters who are not certified. Another aspect of it is pure economic. As you know, in May and now in June, we're seeing that second impact of the pandemic when many organizations are trying to improve their cash flow at coming up with different workforce reduction solutions, be it furloughs, layoffs, etc. And certified interpreters, because of the fact they're certified in the HR ladder, have priority. So if there are 2 interpreters in an organization, one certified, why not? Of course, the one who is not certified will be more likely to be laid off, etc. So the economic aspect is very, important to consider. And also that whole agility and adjusting to stress. Our exams are not easy, and coming and taking the exams when you're an adult is not easy. Even going through the stressful process of certification, and I call it stressful in this context, prepares you to face different realities that is not your daily life, and that helped you, I think, when we all struggled with having to do everything remotely, to when there were things that we never considered would happen, that will be in the same room with the IT professionals trying to figure out whether your cell phone or your laptop would work to connect to the intranet of the hospital. So all these things happened because I think certified interpreters are more prepared to provide quality service, and also to more prepared to advocate for the profession, because the requests and people who reached out to us with the help to advocate for the use of personal protective equipment for interpreters, the questions for remote interpreting protocols, they were all certified interpreters. They were the ones who understood the importance of doing things right and understanding the limitations. I also was happy to when one of the groups in New York City reached out to us and said, we want to organize volunteer interpreters. Should we ask for everybody to jump in, or should we establish some quality criteria, etc.? And my response to them was, the crisis is not the moment to train anybody. You cannot do a good job of training from scratch, that is, right? You can adjust, like how to use Zoom for interpreting, how to be a remote, video interpreter versus face-to-face interpreter, but underlying things you cannot change. And so what our response to that group was, try to find already certified interpreters who you can rely on, because you better have correct quality interpreting or no interpreting than bad interpreting, because delaying the interpreting because the person is not qualified is much worse than saying that we don't have anything, rely just on the medical means and not on communication. I hope I answered your question.
Yes, you did. That brings me to the next question. What are your thoughts on how this new reality hinder or help language access for patients and customers? And what do you think will be the role of the technology in tomorrow's world of interpreting?
That is the question. If you remember, we discussed as part of our roundtables during the summit in 2019, and that was kind of the conclusion that no matter how much we're trying all to resist the intrusion at that time, that's what we all felt. It was an intrusion of technology. I think within like first 2 weeks in March, we understand that this is the only way to do things. And if attorneys had to take their exams online, if they had to counsel their customers via remote means, if the Supreme Court justices had to convene and conduct the hearings remotely, it would, at this point, it's not a question. Technology is here, it will stay. Now, how do we use it? That's always the important thing. The first thing I hope we all will understand, all these inroads that were made with the IT departments at hospitals or at your language companies, when we all became very savvy now about the difference between Zoom and Skype and Microsoft Teams. We know which settings to turn on, to turn off. So we need to keep that knowledge and capitalize on it, because now IT people know that we exist, and we need to continue that dialogue, because the next thing we all will face as individuals who will be seeking care ourselves and as interpreters will be telemedicine. It's already here, it will stay, and as many of you have discovered that certain platforms are not compatible with telemedicine. So it's important to keep that dialogue with the healthcare providers, that we're part of their telemedicine, virtual health communications with the patients and with IT teams, because they need to understand that there are not 2 audio or video streams, but really 3 video streams, audio streams that they have to deal with. As far as the telemedicine or virtual health, I think it will bring us more work, because when it becomes easy to access interpreter, when you work with language companies that are very easy and just click away to add the interpreter to the conversation, then doctors will go back to understanding that communication is the key of their virtual health appointment. They cannot measure your temperature I mean, they can, right? But still, this is not the telemedicine focus will be communicating with the patient, and our, professional core is communication. So the more they realize that communication is not possible without the interpreter, the more they will start utilizing interpreters. And that's why I think we have a brighter future, actually, not intentionally, as a profession than, let's say, even 6 months ago.
So, which leads me to my final question. How do you think the COVID-19 outbreak has changed the role of the interpreter as part of the care team? And how do we make sure that interpreters are properly vetted, well equipped, and receive the support they need to meet the highest level of professionalism?
Well, the important lesson for all of us is that the pandemic showed that we are a member of the team, that without us, certain things simply cannot happen. We also were able to see how each member of that team, the doctor, the technician, nurses, had to adjust. You all hear and read that nurses who never worked with ventilators were trained to do that, and they had to step in and change what they do on a daily basis. Nurses who were retired were called back because they have that knowledge that confirmed through their licensure, through their certification, confirmed body of knowledge and skills that could be utilized in a crisis. The same thing, is true of the interpreter. And the interpreter now needs to make sure that what we gained through these conversations stays here. And it's important to be proud of your certification, and also for us as the community of language professionals to think of other ways how we can offer this certification to interpreters of all languages. We do have the first step, which is the Core CCHI knowledge exam, and we have the English to English performance exam study underway. We're going to publish the preliminary results within a week or so that show that promise that we can test any interpreter's abilities to transfer meaning via the monolingual English to English exam. So having this more opportunities for interpreters of languages like Kinyarwanda, Burmese, to confirm the fact that they are professionals as equal as interpreters of Spanish, Mandarin, Russian, etc. That's something that we as a profession need to continue working on, because all our care team members have certifications and we cannot be behind them. If we nobody even thinks of thinking like, well, you know what, my neighbor, she's good with medical advice, she reads a lot of internet, how about I'll go to her instead of to a nurse, right? Nobody does that. We all can do self-medications, but when we need care, we go to certified professionals, to hospitals that are accredited. And the same thing applies to our profession. We need to maintain the high standards. The trainers need to create more opportunities to train about virtual interpreting, about working effectively with the care team, being visible to the care teams. That's what we all have to do, and I'm excited that we'll be doing with it. And just the fact that we're having this interview is also contributing to the change that language companies understand that their role is not just strictly business. It's also providing education to the public. It's sharing the resources to the ability that each company can do that. So I want just to commend you for holding these interviews, but I think it's a very important moment that we all understand that, yes, we may have different interests and different angles, but we all want to achieve the same thing.
Thank you. Thank you very much. And thank you for your time today. And we look forward to the great things to come from CCHI. And I want to personally thank you for the leadership role that your organization took during the pandemic and kind of the guiding light that you showed to people who needed that guidance at the time. Thank you. Thank you again.
Thank you very much, Mila.